Is there anybody out there? This is mental health in the emergency department. Our systems are pretty slick for pneumonia, sepsis. Trauma is probably one of our shining moments in acute MI. We know that you're critically ill, time is money, you get slipped through an amazing system, and we know that you're giving you modern emergency medicine care. You come in critically ill with mental health, the clock stops, our systems fall apart, and you know what? A lot of the time we're just not good enough. So if you take away nothing else from this talk, I just want us to be able to stand here in a few years' time and be confident that if someone comes into us with a mental health emergency, that we can be just as proud, just as slick, and know that we're giving really good care to those patients as we are for those with physical conditions. This has taken a long time to get us to this year, and it's probably the year of mental health for emergency medicine, which will go into next year. As lots of you are aware, we're doing our first ever college audit of mental health. And that is for us to try and demonstrate that we give good quality care to these patients. And so I implore you to make sure that you do the audit and that you get good returns, and so that we can really start analysing and showing off emergency medicine how good we are at looking after patients with mental health. There is one key document which was out this year called the Mental Health Concordat, and that is government driven from the Department of Health, and it's about, the main thing from us is delivering emergency mental health care through a system that works. If you do nothing else this year for your trust to do with mental health, make sure that you get on to the system and the committees locally, because they cannot sign off their mental health concordat plan unless the acute trust signs it off too. If you withhold your signature, then your local mental health concordat plan cannot go forward. And the key phrase in the whole of the document is that access to emergency mental health care must match the footprint of the acute trust. For many of us, that will be game-changing because we've had to do a lot of referrals across boundaries. You have to know where a patient's GP is. This is our one opportunity to really make a difference to the delivery of mental health care. So please, if you ignore everything else I've said, everything else I write, please do that. There is a mental health toolkit which is on the website, which has got loads of resources to help you get a better service for your department for our patients with mental health. Remember, you're not looking for mental health patients, that you must all have been affected by people within your family, within your department, within your friends who are affected by mental health. So we are not trying to create a service for a separate cohort of patients. We're trying to get us all better at delivering good care to patients with mental health. So we have the college audit, which I want you to join in with, and let's show that we're good at what we're doing. And I want you to think about, are you robust in the way that you train your staff into how they deal with patients? I have a patient advocate who I've worked with nationally, and she sits and talks about what it's like to be a patient in the emergency department, to hear yourself being handed over to someone else as there's the one who comes in all the time and she's in with her normal overdose. Just think how that would make them feel. Let's do a better service to the patients with mental health, and let's demonstrate that through good audit. So your one take-home message is get someone from your trust into the mental health concordat. And for your major resource, go to the college website, Mental Health Toolkit for Emergency Departments.